Me on new technology in podiatric surgery using radiofrequency.
Good afternoon. I'm not sure how I can segue the last to this, but we're going to kind of make an abrupt turn here and talk about something completely different. We're going to talk about healthy people. By the way, Lee was joined me in Buffalo last year at our symposium, wound symposium at the hospital. And Lee, it's not snowing yet in Buffalo. It wasn't this morning anyway. So, just a disclosure, I'm the Speakers Bureau for several wound companies and the medicines company. So the objectives today in a very, very short time that I have to talk to you guys is to talk about the basics of a new surgical technique, radiofrequency or electrosurgery, and try and give you an understanding how this could fit into your everyday practice, and I'll show you a couple examples of the techniques. So let's define the terms. Radiofrequency surgery is a technique using high-frequency radio waves, which will produce very fine and non-destructive cutting and coagulation effect available in any surgical field. Basically, a new tool in our surgical toolbox, which I want you to be aware of. It's become an invaluable tool in my private practice. So radiofrequency, by definition, is high frequency, 3 to 4 megahertz, and I vowed when I left my physics class 100 years ago in college that I would never talk about megahertz again, but here I am. It's a very high frequency, 3 to 4 megahertz per cycle, as opposed to hyplication and Bova units. So there's no shock effect, there's no spark effect. High frequency, very little tissue damage, if any, less heat for sure. So the evolution of where this came from, first about 1926, we had the Bova unit, which is alternating current, very low frequency and low wattage and low voltage. It creates basically a third-degree burn wherever you touch the skin or the tissue. The hypercator, higher frequency, alternating current, high voltage, low wattage, and basically produces a spark and actually operates at a very low megahertz, and its effects are primarily very superficial and destructive. Those of us who were in practice before Lee was born used hypercation to remove warts, and you could see the burning effect that the hypercation caused. So the radiofrequency unit converts household current basically to a high frequency megahertz wave. Very similar to marine band radio. Passage of these high frequency waves between electrodes and through tissue cause the tissue to heat slightly due to the resistance, but there's a metallic wire electrode attached to the unit that focuses the heat. The electrode itself remains cool to the touch. This technique was developed by a dentist in 1976. He wanted to develop some sort of a surgical instrument to precisely cut gingival tissue without tissue shrinkage or necrosis, and it's very atraumatic. A noteworthy advantage to the traditional cutting methods that we've been using. This lack of trauma, which you will see, results in less scar, the superficial heat that's produced does have a sterilization effect. It works pretty much the way a CO2 laser works. It has a high affinity for water. Our body cells are composed mostly 80% of water, so basically these targeted cells absorb that energy and expand, and that pressure results in the volatilization of the cells, and that low temperature steam aids in coagulation actually. And again, very similar to how a CO2 laser works. As it cuts, it coagulates. You have the opportunity to shave off a skin lesion or scoop out the whole lesion. We'll show you a couple samples in a minute, so there's no need for suturing. No pressure, so there's no mechanical damage. Obviously good visibility, and there's multiple tips that you can use for the unit. So I want to talk again, just to go back to a little physics, about what we call the lateral heat principle, which is important for everybody to understand if you're going to find some use for this unit in your private practices. Lateral heat, by definition, is the accumulation of heat in the tissue. So there's this formula that defines what lateral heat is. basically time times the waveform times the power times the area, meaning the electrode size, over frequency. So the higher the frequency, the less heat in the tissue. And I'm giving you this information to give you a good idea how this whole unit has developed and how it can work for you. So with time, the tissue damage, the amount of heat in the tissue is directly proportional to how long that electrode is in contact with the tissue. And there are a variety of electrodes which you'll see which minimizes the actual contact time of the tissue itself. Waveform setting, the units basically have three waveform settings. The cutting waveform, which is 90% cutting and 10% coagulation, which is the most powerful and gives us the quickest healing rate and the best cosmetic result, and basically is ideal for skin incision and biopsy of lesions. There was, by the way, just as an aside, there was an interesting article in a podiatry publication 2 weeks ago, I think, about the fact that the podiatric profession does the least number of biopsies of any other medical profession. I might be misquoting him somewhat, but basically it's true that I don't think, from what I see amongst our colleagues, that we do enough biopsies of tissues. And using this unit gives us a really nice way to do that, and we'll show you a couple methods of how to do that. The second waveform setting is 50-50, 50 cutting, 50 coagulation. Again, this is a type of electrode a waveform that you can use to cut and coagulate at the same time, used in high vascular areas. And the last waveform is the coagulation, which is 10% coagulation and 10% cutting and 90% coagulation, where you need basically hemostasis. And power is important. Too much power causes more tissue destruction. Insufficient power will also cause a problem because it allows, when you drag the electrode over the area, it'll prolong the contact time, which of course we don't want. In the area is basically the area of the electrode. The larger the area of the tip, the greater the lateral heat and the greater the tissue damage. So we have a large arsenal of tip types and sizes to use depending on the type of procedure you're doing and the type of lesion you're addressing. As you can see, just some examples of electrodes. This one on your left is one that we would use to actually scoop out a cutaneous lesion. These lesions are flatter and are used basically if we're going to remove a lesion layer by layer. And these are very often used by plastic surgeons where if they're removing lesions of the eyelid or other lesions of the face where you don't want to create a deep defect. You scoop layer by layer. You just layer the lesion off one layer at a time until you're flush to the skin surface that prevents scarring. Very important in plastic surgery, especially the face. And then there's coagulation ones, electrodes, and cutting electrodes. Be honest with you, I have not yet had the opportunity to use these cutting electrodes. I've seen plastic surgeons and vascular surgeons use these to remove soft tissue masses with deep dissection rather than using scalpel. Next time I come, and I talk about this, I will show you some videos of where you can precisely cut the skin, deepen the incision to find a ganglion, neuroma, or whatever, and remove that without damaging any of the surrounding tissue, as you generally do with a scalpel. And again, the frequency, the optimum frequency is 3 to 4 megahertz. That allows for accuracy of cuts and minimizes tissue destruction. Just a little summary of this whole frequency thing. You can see household current is very low, bifurcation Bovie, and then the radio wave device at 3 to 4 megahertz. Gives you a good example of the tissue destruction from a low megahertz on the left to a little higher in the middle to the radio frequency unit. You can see that there's no tissue destruction on the picture on the right. Lower the frequency, the greater the damage you're doing. So I mentioned plastic surgery. Dermatology uses these units all the time across the world. This is a relatively new device in podiatric surgery. So some specific uses in the podiatric practice are incisions for soft tissue intervention, excisions, shave excisions if you need to be careful about scarring, curettage, cautery, and matrixectomies. Just a couple examples: multiple warts on both sides of the first and second toes. 2 weeks after radiofrequency procedure on these warts, the patient's skin is totally healed. Single plantar warts on the left, post-op on the right. Porokeratosis also is used to remove it either by biopsy, by taking that loop that you saw over on the left, the first electrode that I showed you on the left-hand side, that loop, or a small triangular one to actually shave one layer at a time. Just gives you a little picture of the loop on the bottom right and the cutting electrodes on the bottom left, and those are the two shaving electrodes at the very top. Just to again go over once more the various waveforms. The cutting one is the one I use almost always for removal of skin lesions because it's fast, greater healing, and less lateral heat. The cut coagulation setting is ideal for tissue dissection, especially if you need some sort of coagulation at the same time. And finally, the coagulation one, which is basically a coagulation setting with very, very little penetration of the tissue. Typical nail deformity. I think if this video works, you'll see the special electrode for matrixectomies. We've removed the lateral side of the medial side of the nail. You have to have faith when you're doing this procedure because you hear nothing, you see nothing happening. So the electrode goes where the matrix is, you hold it down for 2 seconds, you repeat that 2 or 3 times, and you're done. You don't see smoke, you don't see sparks, you don't see glowing of the tissue like you would if you used laser. But the procedure itself is done with a local anesthetic, probably takes about 1.5 minutes to do. And I've been using laser in my practice for 20 years, I think. And the healing rate from this nail procedure is like miraculous. Significantly better than phenol alcohol or laser or obviously, or even Winograd, the old Winograd procedure. There was no pain afterwards, and these toes are healed within a matter of a few days. And I've done partials and I've done total nail procedures with this several times. Again, the technique is best to place the electrode, hold it down for 2 seconds, pause 2 to 3 seconds, repeat it, pause 2 or 3 seconds, repeat it, and you're done. This is a shade removal video. And so this is actually not in a foot, but this was actually a dermatologist, and what he's doing is shaving one portion at a time to reduce heat. The technique basically is to moisten the soft tissue, moisten the area first with moistened gauze, so it's wet, and then you're just shaving one layer at a time. You shave a layer, and then you can wipe it off with moist gauze, shave a layer, wipe it off with moist gauze until you're down to normal skin. And there is no scar, and it's healed within a matter of a couple days. Or you can do it this way with a loop and just excise the whole lesion in one fell swoop. There's a little learning curve to doing this procedure because you want to be careful you don't go past the fat layer and create a scar. That was pretty easy, quick swipe technique, and then you're done. And this is a perfect lesion to send for biopsy. The minimal heat that's generated is not destroying any of the cells. You're taking the lesion itself as well as some normal skin around it. And the dermatopathologist that I send my specimens to finds no problem identifying the type of lesion it is after this procedure is done. Moisten gauze first to reduce the lateral heat. So there's a lot of unasked for opinions in the world, the dermatological world, especially cosmetic surgery in 2003, plastic and reconstructive surgery. I don't have the year, but it has truly been used all over the world and very successfully. Has not yet, or it's just now reaching the podiatric world, which is why I'm here today to discuss it with you. JAPMA did publish an article with 84 patients with warts, had a 96% success rate, and in American Family Physician had recurrence rates very low as 1 to 2%. Family practice doctors are using these too also, by the way, besides dermatologists. So what are the advantages? It's portable, you don't need any special arena to use this, you can put it in any room. Low maintenance, the procedure is extremely fast. There is no bleeding. You can be very precise, although there is a little bit of a learning curve. Minimal trauma, much faster healing. Because of the sterilization effect, it's very rare to develop an infection. Improvement with scars, very little pigment changes also. And if you compare it to the laser, and I told you earlier that they basically function the same way by boiling the water inside the cells, it's very reasonably priced. It's probably a tenth the cost of a laser. Excellent results. And I think you can actually find more uses for this device than you can with a laser. I can tell you that doing a tissue biopsy using laser is virtually impossible. And this is the unit. There is there's a table, one of our exhibitors has it, for you to take a look at if you'd like to. But a whole bunch of CPT codes it can use, you'll never be able to read that. So the questions that you need to consider after you spend a couple minutes thinking about what I talked about this afternoon and spend some time out in the exhibit hall, just think of the patients you're seeing in practice. What do you think the patient demand is for this procedure? I think personally in my practice it's very high. And if I don't offer them, where are these patients going? Are they going to the plastic surgeon? Well, they're probably staying to the family doctors because the family doctors are trying to do all this stuff themselves too. Clearly will increase revenue, I think, because you're going to be doing more procedures. So you can start doing it from the first time you use it, but I think there is a learning curve, so you need to practice your techniques. And hopefully there'll be some workshops during the year that you can come to. If we don't have one at this meeting in a future date, maybe we can arrange that. But there are a lot of people that can teach you advanced techniques about it. So thank you very much.